Stamina rehabilitation is an innovative, full-body protocol and treatment technique. Stamina has identified 37 muscles in 14 regions as a system of stabilizing load management muscles. The Level 1 theory and lower quadrant course sets the foundation of Stamina. Immediately following this course, you have the skills to more effectively treat pain and pathology. The Level 2 upper quadrant and full body integration course will further alter your current perception of injury, musculoskeletal pathology, and treatment. Stamina is a fresh approach to treatment, producing dramatically improved patient outcomes. Stamina focuses on the kinetic chain of support emanating from the psoas, distributing loads from the spinal tower and grounding through the legs. This theory is supported by proven engineering principles. Pat Tannant is a manual physiotherapist in practice for 41 years. This is what she has to say about integrating Stamina into her practice.
Throughout my career, I've continually searched for a comprehensive treatment that involved the whole body. 3 years ago, Elena Serrata contacted me regarding a new treatment that she had developed over a period of 15 years. I was, of course, a little skeptical initially, but upon hearing her theory, the biomechanical and the engineering concepts behind Stamina, I was intrigued enough to try. I asked her to treat my body so I could feel it. I knew immediately Stamina was a unique and effective treatment that I wanted to use with my patients. With each level of training that I took, I was able to take that training to my patients immediately. Long-term patients who had well-established manual therapy programs suddenly had increases in strength and stability and improvement in function and decreased pain levels. Even the most sensitive and difficult to treat patients suddenly improved. I was fascinated with the new concepts and treatment techniques of Stamina. When Elena asked me to join the Stamina Clinic and Academy, I recognized the importance of Stamina to medical professionals worldwide. I realized that teaching Stamina could very well be the most important accomplishment of my career. Stamina is as important a change to rehabilitation and management of pathology as Cyriac's orthopedic assessment, as McKenzie treatment, intramuscular stimulation, acupuncture, and manual therapy itself. Stamina enhances the value of these iconic treatments, providing a more comprehensive and successful treatment for your patient.
To date, we have identified 37 stabilizing load management muscles. Similar to guy wires, muscles stabilize structure, conduct load, and are very sensitive to position. Stamina manual alignment techniques correctly position each muscle for optimal function. The primary stabilizing load management muscles, the psoas iliacus, are first in the kinetic chain of functional movement. Like suspension bridge cables, the psoas iliacus muscles stabilize and manage loads in the lumbar spine, pelvis, and hips. When in optimal alignment, the psoas iliacus leads to dynamic equilibrium within the body, reducing joint compression.
Specific stability strength testing of 37 muscles provides a measurable indication of function, which is graph charted. I'm going to demonstrate right now the psoas muscle test with my patient. So I want you to lift your leg up and out on a diagonal, hold it there, don't let it go, meet my resistance, hold, 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 that's it, hold, okay, and back down.
Using a 0 to 100 stability strength scale, pre- and post-muscle alignment performance is scored and charted. This patient's response is unstable and would be graded at 30 out of a possible 100. Muscles are aligned by moving the muscle fibers stepwise in a medial direction, working perpendicular to the lateral border. Muscle malalignment is one of the leading causes of musculoskeletal pathologies. Pre- and post-first treatment data from 100 random patients shows significant functional improvement.
Okay, so I want you to do that again. I want you to lift your leg, turn your leg in, lift up and out on an angle, hold it, don't let me move it. As you can see, the patient is now immediately stable. There's less recruitment of other muscles. He's immediately able to hold against resistance, and there's an ease of lift as he lifts that leg. As the psoas assumes its optimal position, there's a decompression that occurs within the spine. And the patient can often feel this immediately as less pain. The cumulative effects occur over the next week, 2 weeks, etc., after the first treatment and then with the subsequent treatments, because that decompressive effect goes on and becomes stronger and stronger, reducing the pain levels.
Over 6 treatments, the graph clearly indicates improved stability, strength, and alignment retention.
One of the additional benefits of stamina is that it will identify undiagnosed or undetected pathology, which may have been missed by conventional treatment or by some of the medical testing. If a stabilizing load management muscle is not able to maintain its strength from session to session, if it isn't able to become strong at all with any of the treatment, even the early treatments, it's an indication of something else going on. And it could be as simple as a subluxation in a joint near the area. It could be unstable ligaments. It could be more serious pathologies such as tumors, fractures, spinal cord problems, etc.
This protocol treats the patient for 6 sessions over a 12-week period. Improvements are commonly seen between the first and third treatments. Chronic pathology, such as neuropathy and stenosis, respond well to the cumulative effect of 6 sessions. The majority of patients find resolutions of signs and symptoms within this time frame. Our clinical data indicates the average alignment and strength retention is 90% over 12 weeks. This confirms the positive cumulative effects of optimally aligned, stabilizing load management muscles. Treatment also involves patient kinesthetic education, incorporating new concepts about root causes of malalignment. Integration of these concepts throughout daily life ensures retention of improvements and helps prevent further pathologies. The patient is motivated by the immediacy of improvement in function and comfort. Patients who integrate this simple exercise regime and maintain the principles of correct mechanization experience long-term resolution.
Hi, my name's Kevin, and I'd like to tell you about my experience with the Stamina Clinic. I've had a history of low back pain and rotator cuff injuries that have interfered with my ability to enjoy various sporting activities. I've tried other treatments, but have had no success until I was referred to the Stamina Clinic. I went to the Stamina Clinic and they were almost immediately able to correct my problems and identify the source of the pain. And as well as that, they actually allowed me to take treatments home that allowed me to maintain a healthier body. Now, playing golf, hockey, and other physical activities are much more enjoyable, and I'm sure I owe it all to the Stamina Clinic.
About 2.5 years ago, I had a real bout of vertigo, and I went to doctors, and they said there was no cure for it, and I started searching the web, couldn't find anything. I finally found a friend at my gym who referred me to the Stamina Clinic. When I went to see the Stamina Clinic, after about the first or second treatment, I started to feel a lot better. And my neck, I could actually turn my neck. I couldn't even turn it before. I couldn't do anything. I couldn't function. My life was a mess. And my husband and I like to golf. And now I can do all that stuff. We paint houses, and more people need to do this method so that others can get help. The Stamina Clinic has really helped me in being able to manage my life again.